Hi there, students, and welcome to Crazy Nurse RN channel, where learning becomes a tradition. I'm Criselmer Ducanes, nurse educator, teaching fundamentals of nursing practice. If you have any question or if you want to clarify some gray areas with regard to our topic today, please comment down below. I'll be glad to read your comments and answer your questions. Also, if you want to suggest any topic or content on our next videos, please write them below. And if you find this YouTube channel useful, please click the subscribe button and hit the notification bell to keep you updated for new video uploads. Please do not forget to check the description box below for additional inputs and some clarification with regard to this lecture video. For today's topic, we have hygiene. What is hygiene? It is the science of health and maintenance. It is highly personal matter determined by individual values and practices. We also have your personal hygiene, the self-care by which people attend to such functions as bathing, toileting, general body hygiene, and grooming. It also involves care of the skin, feet, nails, oral and nasal cavities, teeth, hair, eyes, ears, and perineal genital areas. We also have here types of hygienic care. First, we have your early morning care, then morning care, hours of sleep or PM care, and lastly, we have as needed or PRN care. What is early morning care? It is provided by the nurse to clients as they awaken in the morning. Consists of first, providing a urinal or bedpan to the client confined to bed. Second, washing the face and hands. And lastly, giving oral care. We also have your morning care. It is often provided after clients have breakfast, although it may be provided before breakfast. Usually includes providing for elimination needs, a bath or shower, perineal care, back massages, oral, nail, and hair care, and making the client's bed. Next, we have your hours of sleep or PM care. It is provided to clients before they retire at night. Usually involves providing elimination needs, washing of face, hands, giving oral care, and giving back massage. Lastly, we have your as needed or PRN care. It is provided as required by the client. For example, a client who is diaphoretic, sweating profusely, may need more frequent bathing and a change of clothes and linen. Now let's proceed to the skin. The skin is the largest organ of the body. We also have 5 major functions of the skin. First, it protects underlying tissue from injury by preventing the passage of microorganisms. The skin and mucous membranes are considered the body's first line of defense. Second, it regulates the body temperature. Cooling of the body occurs through the heat loss processes of evaporation of perspiration and by radiation and conduction of heat from the body when the blood vessels of the skin are vasodilated. Body heat is conserved through lack of perspiration and vasoconstriction of the body or of the blood vessels. Next, it secretes sebum. So in the next slide, we will discuss about the function of your sebum. Fourth, we have here, it transmits sensations through nerve receptors, which are sensitive to pain, temperature, touch, and pressure. And lastly, it provides and absorbs vitamin D in conjunction with ultraviolet rays from the sun, which activate a vitamin D precursor present in the skin. So these are your 5 major functions of the skin. So now let's talk about sebum. What is sebum? It is an oily substance that, first, softens and lubricates the hair and skin. Also, it prevents the hair from becoming brittle. Third, decreases water loss from the skin when external humidity is low. Next, it lessens the amount of heat loss from the skin due to fats, because fats are poor conductors of heat. And lastly, it has bactericidal or bacteria killing action. Now let's proceed to your sudoriferous sweat glands. These are on all body surfaces except the lips, parts of the genitals. Numerous on the palms of the hands and soles of the feet, and it can be classified as apocrine and ecrine. So when we say apocrine glands, it is located largely in axillae and anogenital area, begin to function at puberty under the influence of androgens, and it has little use in thermoregulation, and it is odorless. However, this, however, when it is decomposed or acted on by bacteria on the skin, it takes on a musky, unpleasant odor. Okay? But normally, your apocrine glands, the sweat that it produced is odorless. Okay? Let's now proceed to your eccrine glands. These are important physiologically, numerous than the apocrine glands, found mainly on the palms of the hands, soles of the feet, and forehead. And it has a cooling effect on the body through evaporation. And it is made up of water, sodium, potassium, chloride, glucose, urea, and lactate. So now let's proceed to the common skin problems. First, we have your abrasions. Next, excessive dryness. Third, ammonia dermatitis, or simply known as diaper rash, acne, erythema, and hirsutism. First, we have your abrasion. It is a superficial layers of the skin that are scraped or rubbed away. Area is reddened and may have localized bleeding or serous weeping. So, the patient is prone to infection. Therefore, wounds should be kept clean and dry. Do not wear rings or jewelry when providing care to avoid causing abrasions to clients. Lift, do not pull a client across a bed. Use 2 or more people for assistance. Next, we have your excessive dryness. Skin can appear flaky and rough. So the patient is prone to infection if the skin cracks. Therefore, provide alcohol-free lotions to moisturize the skin and prevent cracking. Bathe client less frequently. Use no soap or use non-irritating soap and limit its use. Rinse skin thoroughly because soap can be irritating and drying. And lastly, encourage increased fluid intake if health permits to prevent dehydration. We also have your ammonia dermatitis or your diaper rash, caused by skin bacteria reacting with urine in the reacting sorry it is caused by skin bacteria reacting with urea in the urine. The skin becomes reddened and is sore. You have to keep skin dry and clean by applying protective ointments containing zinc oxide to areas at risk, for example, buttocks and perineum. Boil an infant's diapers or wash them with an antibacterial detergent to prevent infection. Rinse diapers well because that detergent is irritating to an infant's skin. Next, we have your acne. It is an inflammatory condition with papules and pustules. Keep the skin clean to prevent secondary infection. Treatment varies widely. Next, we have your erythema. Redness associated with a variety of conditions, such as rashes, exposure to sun, and elevated body temperature. Wash area carefully to remove excess microorganisms and also apply antiseptic spray or lotion to prevent itching, promote healing, and prevent skin breakdown. Lastly, we have your hirsutism. It is an excessive hair on a person's body and face, particularly in women. You have to remove unwanted hair by using depilatories, shaving, electrolysis, or tweezing. Enhance client's self-concept. Now let's proceed to the general guidelines for skin care. First, intact, healthy skin is the body's first line of defense. Nurses need to ensure that all skin care measures prevent injury and irritation. Scratching the skin with jewelry or long sharp fingernails must be avoided. Harsh rubbing or use of rough towels and washcloths can cause tissue damage, particularly when the skin is irritated or when circulation or sensation is diminished. Bottom bed sheets are kept taut and free from wrinkles to reduce friction and abrasion to the skin. Top bed linens are arranged to prevent undue pressures on the toes. When necessary, footboards are used to keep bedcloths off the feet. Next, general guidelines for skincare is the degree to which the skin protects the underlying tissues from injury depends on the general health of the cells, the amount of subcutaneous tissue, and the dryness of the skin. Skin that is poorly nourished and dry is less easily protected and more vulnerable to injury. When the skin is dry, lotion or creams with lanolin can be applied, and bathing is limited to once or twice a week because frequent bathing removes the natural oils of the skin and cause dryness. Next, we have moisture in contact with the skin for more than a short time can result in increased bacterial growth and irritation. After a bath, the client's skin is dried carefully. Particular attention is paid to areas such as axillae, the groin, beneath the breasts, paid to areas such as the breasts, and between the toes where the potential for irritation and fungal infection is greatest. A non-irritating dusting powder tends to reduce moisture and can be applied to these areas after they are dried. Clients who are incontinent of urine or feces or who perspire excessively are provided with immediate skin care to prevent skin irritation. Body odors are caused by resident skin bacteria acting on body secretions. Cleanliness is the best deodorant. Commercial deodorants and antiperspirants can be applied only after the skin is cleaned. Deodorants diminish odors, whereas antiperspirants reduce the amount of perspiration. Neither is applied immediately after shaving, because of the possibility of skin irritation, nor are they used on skin that is already irritated. Next, skin sensitivity to irritation and injury varies among individuals and in accordance with their health. Generally speaking, skin sensitivity is greater in infants, very young children, and older people. A person's nutritional status also affects sensitivity. Emaciated and obese people tend to experience more skin irritation and injury. The same tendency is seen in individuals with poor dietary habits and insufficient fluid intake. Even in healthy people, skin sensitivity is highly variable. Some people's skin is sensitive to the chemicals used in skincare agents and cosmetics. Hypoallergenic cosmetics and soaps or soap substitutes are now available for these people. The nurse needs to ascertain whether the client has sensitivities and what agents are appropriate to use. Lastly, we have agents used for skincare have selective actions and purposes. So these are the 6 general guidelines for skincare. Now let's proceed to bathing. It removes accumulated oil, perspiration, dead skin cells, and some bacteria, and it stimulates circulation, produces a sense of well-being, and offers an excellent opportunity for the nurse to assess clients and opens the door for establishing trust. Excessive bathing can cause dryness of the skin, especially for older clients. We have two categories of baths. We have cleansing baths and therapeutic baths. For your cleansing bath, this is given chiefly for hygiene purposes and includes these types. First, we have the complete bed bath. Next, self-help bed bath. Third, we have the partial bath or abbreviated bath. Next, we have the bag bath. Next, towel bath. Then tub bath. And lastly, we have shower. For your complete bed bath, the nurse washes the entire body of a dependent client in bed. So this is your complete bed bath. We also have your self-help bed bath. Clients confined to bed are able to bathe themselves with help from the nurse for washing the back and perhaps the feet. We also have your partial bath, or also known as your abbreviated bath. Only the parts of the client's body that might cause discomfort or odor, if neglected, are washed. The face, hands, axillae, perineal area, and back. Omitted are the arms, chest, abdomen, legs, and feet. The nurse provides this care for dependent clients and assists self-sufficient clients confined to bed by washing their backs. Some ambulatory clients prefer to take a partial bath at the sink. The nurse can assist them by washing their backs. Next, we have your bag bath. This bath is a commercially prepared product that contains 10 to 12 pre-soaked disposable washcloths that contain no rinse cleanser solution. The package is warmed in a microwave. The warming time is about 1 minute, but the nurse needs to determine how long it takes to attain a desirable temperature. Each area of the body is cleaned with a different cloth and then air dried. Because the body is not rubbed dry, the emollient in the solution remains on the skin. Towel bath. This bath is similar to a bag bath but uses regular towels. It is useful for clients who are bedridden and clients with dementia. The client is covered and kept warm throughout the bathing process by a bath blanket. The nurse gradually replaces the bath blanket with a large towel that has been soaked with warm water and no rinse soap. The client is then gently massaged with a warm, wet, soapy towel. The wet towel is replaced by a large, dry towel for drying the client's skin. We also have your tub bath, often preferred to bed baths because it is easier to wash and rinse in a tub. Tubs are also used for therapeutic bath. The amounts of assistance the nurse offers depends on the abilities of the client. There are special designed tubs for dependent clients. These tubs greatly reduce the work of the nurse in lifting clients in and out of the tub and offer greater benefits than sponge bath. We also have your sponge bath. These are suggested for the newborn because daily tub baths are not considered necessary. After the bath, the infant should be immediately dried and wrapped to prevent heat loss. Parents need to be advised that the infant's ability to regulate body temperature has not yet fully developed. Infants perspire minimally, and shivering starts at a lower temperature than it does in adults. Therefore, infants lose more heat before shivering begins. In addition, because the infant's body surface area is very large in relation to body mass, the body loses heat readily. Lastly, we have your shower bath or your shower. Many ambulatory clients are able to use shower facilities and require only minimal assistance from the nurse. Clients in long-term care setting are often given shower with the aid of a shower chair. The wheels on the shower chair allow clients to be transported from their room to the shower. The shower chair also has a commode seat to facilitate cleansing of the client's perineal area during the shower process. Now let's proceed to your therapeutic bath. These are given for physical effects such as to soothe irritated skin or treat an area, for example, your perineum. Medication may be placed in the water. A therapeutic bath is generally taken in a tub one-third or one-half full. The client remains in the bath for a designated time, often 20 to 30 minutes. If the client's back, chest, and arms are to be treated, these areas need to be immersed in the solution.